In the world of bariatric surgery, the two most effective procedures to help with weight loss are the gastric bypass and the gastric sleeve. But how do they work? And what kinds of results or issues can you expect from each? Hi, I'm Dr. Brian Young, a naturopathic doctor in Toronto. We'll be talking about weight loss surgeries on this channel, so subscribe if you're interested in learning more. Full disclosure, I'm not a surgeon, so I'm not an expert on the actual procedures. Rather, I help to support patients who've had these bariatric surgeries done by assisting in their post-surgical recovery and long-term weight loss. Let's compare gastric sleeves and gastric bypasses and learn from the experiences of patients who've undergone them before to help you decide if you should get one of these procedures done yourself. The gastric sleeve, also known as the vertical sleeve gastrectomy, removes a large portion of the stomach, leaving a smaller banana-sized stomach. Typically, anywhere from 60 to 90% of your stomach will be removed. The gastric bypass, also known as the root NY, removes nearly the entire stomach, leaving only a small golf ball-sized pouch before bypassing food directly into the small intestines. In both cases, the reduction in stomach size prevents you from eating nearly as much as you would have before. Both procedures are around 1 to 2 hours and are done via laparoscopy. So they make a few small incisions in your abdomen, thread in some cameras and tools, and do everything through those small holes. They're both inpatient procedures, so you'll need to stay in the hospital for a few days. The bypass procedure is more complicated, so the surgery and recovery times are usually longer. Both procedures are also irreversible, meaning you can't undo the surgeries and reconnect parts of the stomach that were stitched off. However, you may be able to transition from a gastric sleeve to a bypass, but you won't be able to transition from a bypass into a sleeve. The gastric bypass is typically the end game weight loss surgery, so to speak. There is one additional surgery known as the biliopancreatic diversion with duodenal switch, also known as simply the duodenal switch or BPDDS, that some patients may be able to transition into even if the bypass isn't working, but it's a complicated procedure that's not commonly done. Side effects and complications. Because bypass surgery is more complicated than sleeve surgery, there's more potential for things to go wrong during a bypass. So high-risk patients with complicated heart or pulmonary issues, or patients who've had many abdominal surgeries in the past and have a lot of scar tissue, may find the simpler gastric sleeve more appropriate for them. You'll need to consult with your surgeon to see which options are suitable for you. Pain from surgery should pass with time, although you may need to be on a painkiller as you recover. Temporary hair loss is also common after surgery as your body heals. Initial weight loss can be quick, and in some cases, this rapid weight loss can cause problems, such as increasing the risk of developing gallstones. You may be prescribed a medication like Urzodiol to help reduce gallstone formation. Heartburn and reflux may also be a consistent issue, although it tends to be more common in sleeves. If you eat too quickly, you could also end up with nausea and vomiting. You'll need to eat slowly and carefully, chew thoroughly, and take small bites and portion sizes to minimize these issues. Gastric dumping is another side effect from these surgeries, although it's more common in bypasses. This is when food moves too quickly from your stomach into the intestines, resulting in blood having to rush to your intestines to digest and absorb the food. This causes lightheadedness and dizziness, nausea, bloating, abdominal discomfort, and diarrhea. It can on occasion cause some patients to faint. This mechanism also causes alcohol to affect you more strongly, and what normally took 6 drinks to get you tipsy may now only take 2. You'll need to slow down your eating and drinking and avoid consuming too many calorie-dense and sugary foods or drinks to reduce the risk of this happening too often. Nutritional deficiencies will frequently be an issue, and although gastric sleeves may present less of a risk, you'll still likely have to take a lifelong vitamin and mineral supplement after you undergo either surgery, or even consider vitamin injection therapy if your deficiency is too severe. As a result, fatigue, low energy, and poor exercise tolerance is also common. Make sure you're getting all the necessary macronutrients like protein and fat in your diet, and micronutrients like vitamins and minerals by supplementing or injecting them. Is it effective? For the suitable patient, these surgeries can be very effective. Gastric sleeves and bypasses typically have patients losing around 20 to 30% of their current body weight over a few years. So, a 400-pound individual would be expected to lose around 120 pounds in a few years if things go well. Gastric bypasses are typically more effective than gastric sleeves. This is because although both surgeries drastically reduce the size of your stomach, the bypass not only reduces the size more, but also bypasses the stomach, so less nutrients and calories are absorbed overall. The beneficial effects of weight loss caused by these surgeries can in some cases be life-changing, particularly for those with other issues like diabetes or high blood pressure. Some patients are able to completely come off their diabetes or blood pressure medication. Chronic muscle or joint pains can resolve completely. Of course, these effects are not only limited to those who lost weight from these surgeries, but also to anyone who has lost large amounts of weight themselves, or with the help of other tools like medications or diets. What to expect? Overall, the gastric sleeve and bypass are some of our strongest interventions for weight loss available. But keep in mind that even then, it should always be regarded as a support tool, not a complete replacement for an effective weight loss diet and lifestyle. If you do decide to undergo one of these surgeries, keep these few things in mind. 1. You should not be getting the surgery hoping to eat whatever you want and still lose weight. It will help give individuals the boost and support needed to start implementing a good weight loss diet, but in the long run, it will still not be able to replace it. You'll still have to build good eating and living habits years after your surgery. Remember, there are people who fail on gastric sleeves and bypasses and regain the weight after a year or two because they didn't control what they were eating. If you're interested in the type of weight loss protocol we use for supporting our patients on gastric surgeries, check out our online weight loss program in the description down below. 2. You'll have to meet certain requirements before the surgery is even available to you. Most guidelines require you to have a BMI of over 40, which the CDC categorizes as morbidly obese, or a BMI of over 35 with other obesity-related issues. So you'll need to consult with your doctor to see whether it's appropriate for you to get. And 3. The costs to do these surgeries are not cheap and could range anywhere from $15,000 to $25,000. And even if your insurance is able to cover some of it, you may still need to pay a few thousand out of pocket. Let me know in the comments down below about your experiences if you've had a gastric sleeve or bypass done, and if you have any tips to share. And if you found this video helpful, please leave me a like. As before, I'm Dr. Brian Young, bringing you weight loss info on this channel. Subscribe and hit the notification bell if you're interested in learning more, and share it with someone you know can use the help.